هاي، السكتة الدماغية هي حالة طبية طارئة، كل دقيقة هي ثمينة جدا، من هيك لازم نعرف عوارض السكتة ونتحرك بسرعة لحتى نتفادى مضاعفاتها. رح يكون عندي لقاء مميز جدا مع نورجول فاتنسيفير، نائبة رئيس ميدترونيك العالمية للأجهزة الطبية، لحتى تخبرني بدقيقة واحدة كل شيء لازم نعرفه عن ستروك والتقنيات الحديثة لمعالجتها. Hi Nurgul.
Hi Riva.
I'm glad to have you with me today. Welcome to my YouTube channel.
It's my pleasure. Thank you very much for inviting.
I would like to introduce you to my viewers. You are Nurgul Vatansever. You are the Vice President at Medtronic, which is a leading company in applying biomedical engineering in research, design, and manufacturing of medical devices. You are in charge of the CEMA region, which stands for Central Eastern Europe, Turkey, West Asia and Levant, Middle East and Africa. Did I get it right?
You get it right. I'm responsible for restorative therapies group of Medtronic company.
As you know, it's the World Stroke Day. Today we're going to talk about stroke, but in a different way, because we have to be faster than our stroke. So I'm going to ask you a few questions, and please give me your answer within 1 minute. Are you ready for this challenge?
I'm ready for the challenge.
Okay, let's start. Question number 1. What is stroke?
Riva, stroke occurs when blood vessel in the brain ruptures and bleeds, or when there is a sudden blockage in the blood supply to the brain. When the blood supply is interrupted, the brain no longer gets the oxygen, the nutrients it needs, therefore causing brain cells to die by the minute. The brain is a very complex organ that controls multiple body functions. When stroke occurs and blood flow cannot reach a part of the brain that controls particular body function, that body function can be impaired as a result. The effects of stroke range from death to paralysis of one side of the body and permanent disability.
Why are you interested in developing solutions and devices regarding stroke?
According to the World Health Organization, stroke is the second leading cause of death and third leading cause of disability worldwide. Globally, 1 in 4 adults over the age of 25 will have a stroke in their lifetime.
Wow.
This year alone, 14.5 million people worldwide will experience a stroke, and 5.5 million people will die as a result. This gives us responsibility as Medtronic being the leading medical devices company in the world.
What are your new innovations regarding stroke care and management?
As I mentioned, Medtronic is committed to elevating pain, restoring health, and extending the life of patients. When it comes to stroke treatment, we deliver our mission by harnessing the power of innovation, hence our technologies. For example, Solitaire X is Medtronic new generation device for acute ischemic stroke with a unique technology that allows physicians to draw clots out of the patient, significantly improving patients' outcomes.
That's great. So this is something doctors and healthcare professionals need to know about because it will help them prevent disability and brain damage. Why is awareness important, and what are the key messages we need to know about stroke?
Stroke can happen to anyone at any age, and its consequences can be life-changing. But it doesn't have to be that way. The most severe effects of stroke are preventable and treatable. 80 million people have survived stroke worldwide. Unfortunately, many patients are not going to hospitals now to take the care that they needed in time, which can significantly reduce their chances of outcome. Especially now, raising awareness about the signs of stroke is the key, as 1 in 4 will rely on those closest to them to tell they're having a stroke and call emergency services. Knowing the warning signs of a stroke and acting fast can save up to 2 million neurons per minute, could save thousands of lives every day, and prevent permanent disability. Stroke patients race against time, so we have to think and act fast.
So we need to know the signs and symptoms, and we need to act fast. What are the signs and symptoms?
Let me tell you, FAST can help spot the signs of a stroke and seek help quickly. F stands for face drooping. Check one side of the face droops, or is it numb? Ask the person to smile. Is the person's smile uneven or lopsided? A stands for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downwards? S letter stands for speech. Is speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence. And T stands for time to call emergency services. If the person shows any of these symptoms, even if the symptoms go away, it's imperative to immediately call emergency services. So we have to act fast, think fast, and act fast.
How much time do we have?
As soon as we start observing signs of a stroke, we have to act fast because we can save up to 2 million neurons per minute and prevent permanent disability.
So time is very precious. You have some other artificial intelligence programs that doctors need to know about, will help them in stroke management and treatment. So can you tell me more about it?
Yes, we do leverage artificial intelligence in stroke care. Our new software, Rapid, is an artificial intelligence-powered imaging software that allows doctors and first responders to quickly identify brain events and, all importantly, speed up the treatment of patients suspecting of having stroke.
Do you think COVID-19 has impacted the diagnosis and quick response of stroke?
Yes, definitely. The pandemic has had a critical impact on disease prevention in general. The World Health Organization conducted an assessment survey on these diseases service delivery among 194 ministries of health in May 2020. The survey confirmed that the prevention and treatment for those diseases, including cardiovascular diseases, diabetes-related diseases, even cancer, have been severely disrupted since COVID has started.
I think a major key message that we shouldn't be afraid of going to the hospital if we experience any signs of stroke because of COVID-19.
So true. Many patients delayed their critical care and even visiting doctors in fear of getting the virus. And patients are reporting their symptoms a few days later after the onset of stroke symptoms, which significantly reduces their chance of recovery. So you're right, Riva. As soon as we observe the stroke signs, we should immediately rush our loved ones, friends, families to hospital for treatment.
Stroke management requires a multidisciplinary approach. How is Medtronic making a difference in this aspect?
Stroke is one of the leading causes of death or permanent disability, yet it is treatable. This is why we as Medtronic feel the responsibility and put our focus and attention on how we help save stroke patients. For that reason, we partner with medical societies, stroke centers, healthcare professionals, and even governments to optimize stroke patient pathway, the processes, resources, and moreover, establish comprehensive stroke treatment centers. Medtronic is also helping reduce the recurrence rates and lasting health problems by sponsoring clinical registries to improve post-stroke treatment. We also provide therapy awareness and specialized physician training programs to help healthcare system become more efficient at responding, treating, and managing stroke patients.
Nurgul, thank you so much. You helped in creating awareness about stroke. You gave us all the information in 1 minute.
Riva, I understand you have a great mission to create awareness around healthcare challenges. And I enjoyed our conversation a lot, and I'm very happy to be part of it. I'm looking forward to meeting you again. Thank you very much.
Thank you. Bye-bye.